This video summarizes the Phase 2 SMART START trial of ibrutinib, lenalidomide, and rituximab plus chemotherapy in newly diagnosed non-GCBD LBCL. This activity is supported by educational grants from Amgen and Celgene Corporation. Rituximab is commonly used in R-CHOP to treat DLBCL. Lenalidomide and ibrutinib have shown single-agent activity in relapsed ABCD-LBCL. A Phase 2 study of RLI in relapsed/refractory non-GCBD-LBCL showed a 55% ORR. The SMART START trial determines RLI efficacy before and with chemotherapy in newly diagnosed non-GCBD-LBCL. This was a single-center, non-randomized Phase 2 study involving patients with high-risk, newly diagnosed non-GCBD-LBCL. Patients received 2 cycles of RLI, followed by 6 cycles of RLI plus EPOCH or CHOP. Primary endpoints included ORR after 2 RLI cycles and CR after the full regimen. The median age of the 60 patients was 63.5 years. Half of the patients were female, and 51.7% had a poor IPI score of 3 to 5. High Ki-67 was observed in 77% of patients, and 65% had stage 3 IV disease. The most common all-grade adverse events were nausea, peripheral sensory neuropathy, diarrhea, and oral mucositis. The most common grade 3/4 AEs included anemia, thrombocytopenia, and neutropenia. There was 1 grade 5 event of febrile neutropenia and CNS aspergillosis. Response rates were high. ORR was 86% after 2 cycles of RLI and 100% after 2 cycles of RLI plus chemotherapy. The complete response rate increased from 36% after RLI alone to 96% at the end of treatment. Median time to progression and median overall survival were not reached. The 1-year progression-free survival rate was 94% for double-expressor DLBCL patients, comparing favorably with historical results, although not statistically compared. In non-GCBD-LBCL, RLI, followed by RLI plus chemotherapy, achieved high response rates and prolonged survival compared to historical results. Investigators suggest further studies on novel agent combinations with or without chemotherapy in DLBCL.